Pro Group Management. Workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, Katie Charleson joins us. She's Communications Director for Nevada HealthLink. Here for the whole show on an all-new Nevada Newsmakers.
Nevada Newsmakers Goes to Washington is brought to you by Pro Group Management, workers' comp that works for you. NV Energy. NV Energy proudly serves Nevada, providing electricity to 2.4 million electric customers. And University Medical Center of Southern Nevada, offering the highest level of care in Nevada.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
It's a good time to eat. It's a good time to play.
It's a good time to win.
Ooh, your good times at Tamarack.
Save money and take transit. Did you know you can ride the bus all day for less than what it would cost you for a gallon of gas? Plan your trip now by going to rtcwashoe.com.
Retail's impact on Nevada's economy? Enormous. 8,600 businesses, large and small, employing 145,000 workers. And last fiscal year, retail paid tax on nearly $60 billion in sales. We're the Retail Association of Nevada. We support retail, we help it grow, and we mean business.
RANNV.org.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're pleased to welcome to the program for the first time Katie Charleson. She is Communications Director for Nevada HealthLink. So let's start out for our audience across the state. What is Nevada HealthLink?
Yeah, Nevada HealthLink is the state marketplace. We're run by the state agency, the Silver State Health Insurance Exchange. So where we help people in Nevada not only find, but help them pay for insurance. So it's nevadahealthlink.com, and you can find insurance available to you throughout the entire state, and you can also qualify for subsidies to help you pay your monthly premium.
Okay, and which department of the state helps run this?
So we're our own agency. So we're not under anybody.
Not Health and Human Services or anything like that?
Nope, we don't have any
Division
overhead.
of Insurance?
Nope, we report directly to the governor.
Okay,
the director.
Well, that's a nice route to go.
Yes.
Okay, so what are we looking at in terms of insurance coming up for this year, and how does the Recovery Act play into this?
So this year, for Plan Year 2024, we're going to have 8 carriers and 163 plan options throughout the state. Depending where you're on the state is going to depend which carriers are available and how many plan options are available. Extended subsidies are continued thanks to the Inflation Reduction Act, so they will go on for Plan Year 2024. So subsidies are higher than ever before. If you haven't checked how much it's going to be in a while, I would check again. It's really affordable.
So one of the things that I find most interesting and helpful about Nevada HealthLink is you actually have people who can help people decide what plans are the best for them. Because I, for example, with Medicare, I do not make my choices about Medicare. I have an agency that I go to, and they sit down with me with all the different plans, and they guide me through, and I take their best advice and come up with a plan. This is a wonderful thing for the average person to be able to do.
Yes. We were partner with a statewide network of brokers and navigators. This year we have almost 900 brokers throughout the state.
900, wow.
900, which is more than it's ever been before. So we have a lot of options for help. And insurance is confusing, and this assistance is completely free. So you can go in and talk to a broker or a navigator, let them know your budget, your family size, what doctor you need covered, what medication you need covered, and they can help you find a plan that's best going to fit your needs. Nevada NevadaHealthLink.com, click Find Assistance. You enter your zip code, preferred language, and it's going to pull a list of brokers and navigators near you. And you can give them a call. They can help you over the phone, in person, via Zoom. We have a lot of options, especially for rural Nevada when you might not have someone right there. We can still get you that free assistance. It's available year-round too, so you don't need to wait for open enrollment. You can get that free assistance now to get ready.
Okay, and for rural Nevada, now not every insurance company covers the entire state, correct? So how many, for example, let's just say Elko County, for example, how many insurance choices would they have, or is there a limit of only one perhaps?
It's not a limit of only one. I'd have to get the exact number. I want to say we're around 50 in Elko with about 4 different insurance carriers. So we have a good amount of options. Nobody's under 40 in the whole state, under 40 plan options. So you're going to have
really
options.
Grown in the last few years.
Really grown. We have a lot of options. There's only 4 service areas. If you go online and click media at the bottom of our page, you can see the exact breakdown of what plans. Or if you go on to window shopping, you can pull up a list of plans. But we have a lot available no matter where you are in Nevada.
All right, so let me ask you this. Because a lot of people actually listen to this program, which is great, and we appreciate that. Is this for poor people? Is this for the average earners? Is this for wealthy people? Who are going to use this service?
So Nevada HealthLink is ideal for people who don't qualify for Medicaid, don't have Medicare, and don't have employer-sponsored coverage. So it's really for, kind of the middle America. You have you're working, but your employer doesn't offer health insurance. We're good for gig workers, self-employed, door dashers, things like that. A lot of service industry don't offer health insurance. If you're a hairstylist, I have 2 hairstylist sisters who don't have health insurance. It's great for people like that who have a good income, but they don't qualify for these other programs. We meet you in the middle. So we offer private health insurance and then also subsidies to help cover that monthly premium, making it very competitive with an employer, sponsored plan. Last year, almost half of our enrollees had a plan under $100.
Wow, which is amazing.
Yes.
What kind of deductibles go along with those?
So deductibles are going to range, and you can put that. We have like a filter system on there, so whatever your deductible wants to be, but there's going to be quite a big range of deductibles through our plans.
We're seeing this across the country that are having exchanges like this, across the United States, just beyond Nevada.
Yeah.
That have these kind of exchanges?
Oh, yeah. So we have, sorry.
I didn't phrase that very well.
So we are a state-based exchange. So I want to say there's about 10 throughout the country. And we, it gives us more options to be more flexible. We're not under the healthcare.gov, under the federal. So we can work, we're Nevadans working directly for Nevadans, which is really great. We have our own platform. We're not using the federal platform. We're able to save money that way and offer people more options.
It seems to me that, this is a great thing for people because it's such a confusing topic. And I know just even from my own dealings with my wife and I that making these decisions is pretty tough each year and trying to find the best deal. What kind of subsidies, are we seeing for people?
So it's going to be a range. It depends on your income and family size. You can anonymously window shop right now to see what's available to you. You just enter your zip code, and then whoever needs coverage in your family, their birthdays, and then you can see, and you click check for savings, you can see how many subsidies are available to you. So let's say an individual making about $38,000 to $60,000 a year, anywhere in that range, you're going to qualify for some amount of subsidies. For a family of 4, it goes from $60,000 to about $120,000. Anywhere in that range, again, you're going to be qualifying for subsidies to help you pay for that monthly premium.
Even up to $120,000.
Yes.
That's huge.
Mm-hmm.
It just goes to show the cost of healthcare is so high to begin with. And does everybody accept this? Because I know with Medicare that there are doctors and that just don't accept Medicare patients. Is everybody in the medical industry forced to take this insurance?
Not forced to, but we have a really wide range of carriers that are very accepted. We partner with Anthem, Molina, Hometown Health, 8 carriers that are very common, private insurance carriers. They're not like off-brand or anything like that. So they are carriers that are commonly accepted. When you're signing up for insurance, that's why we recommend getting that free assistance. So you have a doctor, you have a specialist you work with, make sure that is covered under the insurance that you're enrolling in.
Okay, let's take a break. We'll come back much more on this with Katie Charleson talking about Nevada HealthLink. The enrollments are coming up. We'll be right back.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
Early in the morning or throughout the night, professional truck drivers are on the job, serving you, safely moving freight that's crucial to our economy. From the oldest industries to our newest innovators, from the exotic to the everyday, trucks are everywhere, moving everything. Never afraid to embrace a future that makes Nevada and our nation stronger. Trucking moves America forward.
What do you count on? You count on your power every day. At NV Energy, we've always powered what's important to you, but we're not looking at the past. We're focused on the future. While our standards are high, our rates will remain low. And our commitment to renewables isn't just meeting standards, but leading the way. Because you can count on more than just your power. You can count on the company who brings it to you. That's our promise. You can count on it.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Katie Charleson. She's Communications Director for Nevada Health Link. You will see a lot of information coming up about Nevada Health Link over the coming months. I'd like to expand a little bit more on the help for rural Nevada, because I mean, rural Nevada has suffered over the years a lack of doctors, lack of hospitals, in some cases no hospitals. What are the benefits for rural Nevadans from this?
So rural Nevada, we understand it's a very challenging landscape. I'm actually from rural Nevada.
Where?
I live in Gardnerville.
Okay.
Yeah, I've raised my kids there, so I understand the difficulties of just having the care and having to drive out. So having that health insurance, we're going to have coverage for you. So we have a lot of plans. As I mentioned, there's over 40 plans available to any rural, a lot of times more than that. So having that coverage is available, so you can go to that specialist, whether that's a telehealth is getting really big right now, or working with doctors, even if you have to drive out 30-40 minutes to that doctor, you're going to have those coverage options. And we also offer the free assistance throughout our rules. We have brokers that visit Elko, a couple times a month to help people get enrolled, go through their insurance options. We partner with navigators who go to events throughout the state in rural Nevada. And we also, it's a whole all hands on deck effort. So we have brokers, navigators, even Nevada Health Link staff going out there, attending events, dropping off resources. We also just started a tribal sponsorship program, which we partner with tribes to help tribal people get insured, to get that extra insurance. A lot's covered in the tribal health clinic, but if they need any specialty services, that's not covered. So Nevada Health Link has now partnered with our tribes and carriers to get those people covered as well.
All right, what about businesses? Because it seems to me that one of the issues is that small businesses have such a hard time affording health care for their employees. And what is Nevada Health Link able to do for them?
So send them over to us.
The line's out the door.
Yeah, send them on over. If you can't offer insurance to your employees, completely understandable. It's extremely expensive. They can still get subsidies through Nevada Health Link, so they can enroll in coverage with us as long as they're check their income, see how much subsidy are available to them. But we offer resources for small businesses. We have flyers, forms, things like that. We can work with a broker with their small business to help your employees get enrolled.
Okay, how big of a business can a small business be? Because sometimes people are surprised to know that there are $1 million businesses that are, in quotes, small businesses.
Yeah, actually, Clark County School District is one of the biggest employers of people without insurance. Surprisingly,
really?
Yes. So it can be anybody. We're here for anybody. It doesn't matter where you work. You can come to Nevada Health Link and get coverage if you don't have it available to you.
Clark County School District does not have coverage.
Some of it does. So it depends where you're at in there, but they're one of the largest like Medicaid employers in the state. So a lot of people that no longer qualify for Medicaid, can come over to us if they're making over that amount.
There are a surprising number of large corporations in Nevada that people will be surprised to know that they are not able to provide adequate medical coverage.
Yeah.
All right, let's take another break and we'll be right back.
The casino industry drove Nevada's economy for decades. By the 1990s, however, the state's sole industry was in sharp decline. Many were losing their homes, many were leaving the state. Is Reno on track to be the Detroit of the West? Was an October 2010 Reno Gazette-Journal headline. Nevada knew it was time for a change and a time to diversify. Story County took that lead, took risks, invested tens of millions transforming its desert into a place of opportunity and a future for Nevada families needing something new. That desert now provides thousands of high-paying tech, advanced manufacturing, and energy careers at companies like Tesla, Panasonic, Google, Switch, and Redwood Materials. Story County transformed Northern Nevada forever, and the tide of opportunity has raised all vessels through construction contracts, high-paying careers, and the power of payroll. Tens of millions have been generated in sales and property tax, permits, and other revenues for Reno, Sparks, Washoe County, and for all of Nevada. Enough, in fact, to generate a surplus after public services are provided. And best of all, a sustainable economic climate has been created, enabling our children to stay in Nevada and live prosperous lives in their home state. Story County, improving Northern Nevada one industry at a time.
Big R is Northern Nevada's #1 Golden Fire wood pellet supplier. More heat, less ash, 100% natural, and no additives. And there's only one place that stocks this many wood pellets, and that's Big R in Sparks, Winnemucca, Fallon, Fernley, and Lovelock. A river of wood pellets at Big R.
It's the $200,000 Cars and Cash giveaways at Carson Valley Inn. Cash and prize drawings Thursdays and Saturdays. Plus, win a 2023 Ford F-150 or we'll pay you cash instead. Don't miss your chance to play and win. Cars and Cash at the Carson Valley Inn.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Katie Charleson. She's Communications Director for Nevada HealthLink. Now, tell us what's been going on with Medicaid and what's happening with what they call the unwinding.
Yeah. So at the beginning of the pandemic, they stopped redeterminations for Medicaid recipients. So
what does that mean?
So historically, Medicaid recipients had to renew every year. You update your income, your address, things like that. And every year they would have to fill out this packet, let Medicaid know where they're at. Because of the pandemic, that was completely stopped for 3 years now. Which means that people kept their coverage even if they no longer qualified, even if they became over income, got a job that offered insurance, they still kept on their Medicaid. So now that process is resuming. So Medicaid is taking chunks every single month and sending them redetermination packets to make sure that they re-enroll, and if they're over income, they send them over to us. So it's really important that if you're on Medicaid, that you update your contact information. You can go to Medicaid, they have a form, update your contact information. You can also find that on our website. But a lot's changed over the past 3 years. People move, jobs change, family size change. So make sure you're sending in the information. Make sure they have the most up-to-date information. So if you still qualify, you're able to keep your Medicaid, but if you no longer qualify, you can come over to us. We're offering a special enrollment, so anytime you get kicked off of Medicaid, you can come over to Nevada HealthLink, and we can find you an affordable, some are even $0 plans to keep you enrolled insurance. Our priority is to keep as many people insured as possible. We understand that this is very unprecedented times, and it can feel like a lot, having to go through this process, especially people who've never had to do it before, but it's extremely important that you fill out that packet, get it submitted, and make sure you're on the correct program for you.
Okay, is the majority of this money coming from the Recovery Act, or is this also state funding that goes into it as well?
For the subsidies?
Yeah.
It's federal. So the subsidies are federal tax credits. It's no state funding.
Okay, and is that going to continue? Do we know, what the length of that's going to be?
We're 100% through Plan Year 24 and 25. After that, it's unknown at this time. We are fighting to keep those extended subsidies to make it more affordable, to get more people insured. But at this time, we don't know if it's going to continue past 2025.
Okay, let's talk about enrollment dates. What are you looking for in terms of this? Because you can actually jump in at any time of the year, correct?
So open enrollment is November 1st through January 15th. Outside of open enrollment period, you would need a qualifying life event in order to enroll in coverage.
And what would that be, for example?
It'd be having a baby, losing coverage, moving, changing your job, things like that. That would qualify you for a special enrollment period. But November 1st to January 15th is the only time of year where you can freely enroll in health insurance. And it's a really busy time of year. This is when the holidays are, it's busy. So we recommend getting started on November 1st, getting that free assistance, enrolling in a plan, getting it off your plate, having that insurance, that peace of mind for you and your family. And then you have that start date of January 1st. If you enroll in the month of January, your start date is going to be February 1st.
So what did the pandemic do to all of this? Because Nevada HealthLink had started up prior to that, but then in the middle, the pandemic hits. How did that affect what we were doing?
So we started as a state-based exchange in 2019, so we only had a year pre-pandemic as not. So we worked from home, just kind of like everybody else. We kept going. We have a really great team at Nevada HealthLink, so it was pretty much business as usual for us. With the pandemic, though, it did stop those Medicaid redeterminations, so a lot of people stayed on Medicaid, which did change our enrollment numbers a little bit. So that will start changing. We'll start seeing increases over these next coming years. But it's pretty much, for us, it just stay the same.
One of the things that I found great during the whole pandemic situation, which was obviously a terrible situation, but one of the benefits was telehealth. And the ability, for example, to not have to go into the doctor's office and still be able to renew a prescription. In fact, I did one where I was actually in San Diego sitting in my car while my wife was having lunch in a restaurant next door and had that. This is all part of what you guys do?
We help you connect you to the insurance carrier, and then a lot of them do cover that telehealth services. Telehealth is definitely one of those amazing things, got pushed forward really quickly with a pandemic, kind of forced to, everybody was staying home and do that. So it is covered through a lot of our carriers, will be available to them.
Yeah, it's one of the things that I hope that we see it's able to continue, because especially in a state like Nevada where we just don't have the doctors and nurses and healthcare system that we would love to have. Not that the stuff we have isn't great and the medical staffs do a wonderful job, but it's just the number of services available versus the number of people we have in the state has never been a match.
Yeah, and the awesome thing about the plans on Nevada HealthLink is all of them cover those 10 essential health benefits because they're Affordable Care Act certified plans. So they have to cover things like emergency care, pre-existing conditions, pregnancy, mental health services are all covered under every single plan, no matter which level you're at. They have to be included. Vaccines are included in all of these plans. So these are not skimpy plans. These are full coverage plans that no matter which level, we offer 3 levels. You can go bronze, silver, and gold. They're all going to cover these services. And we don't turn anyone away because of a pre-existing condition.
How do you deal with the mental health situation when it's obviously the greatest need we have in the state, if not in the country, and yet we don't have the number of practitioners anywhere in the country that are needed to be able to cope with the need?
Yeah, it's extremely difficult. What is awesome is the telehealth is a huge thing. I have my own therapy, and then you go in a room and they have a big screen and your provider is in Vegas, which is awesome. So the bigger cities, which is nice for rural Nevada, is that there is a lot of telehealth options available now that you can meet with a therapist or get those mental health services over a Zoom, even in an office if it's over a Zoom, so you're at least separated from your home. But those services are getting more and more popular throughout the state.
One of the things I've noticed about the vaccines is that previously they were all free, and now you're getting charged for them. Through Nevada HealthLink, are those all available at no charge?
Yes, vaccines are still covered and they're under the each Affordable Care Act plan.
All right, well, let's go through the enrollment information again so people know how they can get involved in this, because it really seems that with the income range being so great, up to $120,000, that's huge. And families really need this because the cost of healthcare is so high.
Absolutely. It can be devastating not to have health insurance and something happened. We all think we're okay until something happens.
Right.
Someone breaks
and
a
then
leg.
and then you get the bill.
Exactly. And I think these last few years have really taught us that we just don't know is what's going to happen as far as getting sick, and health is wealth kind of a thing. Like, it's important to stay healthy and do those those standard visits too, is doing your check-ins every year. And if you have the insurance, that's going to be covered. If you don't, then that's it's a lot of money out of your pocket. Subsidies are big right now. So going in line, like you said, a family of 4 can make up to $120,000 a year and still get subsidies to help pay for their monthly premium. We recommend getting that free enrollment assistance with our brokers or navigators, or you can give us a call and get connected to an assister that way, or they can walk you through the process. We have a lot of options. They're all completely free to get that enrollment assistance. Absolutely take advantage of it. Let's get started now. It's window shopping right now. You can see all of the plans that we have available. You can work with that assister, and then you're ready to go November 1st. Get it out of the way, get enrolled, and make sure that you and your family are covered.
And get it done by January
15th. January 15th.
All right, well, that's where we have to leave it. Thank you for doing this. We've had a nice association over the years with Nevada HealthLink, and you guys do a terrific job, and it's a great service. Thank you for being here. You're welcome. And we'll be right back.
Imagine a magical garden that feeds Carson City's hungry and homeless, teaches our high school students agriculture, creates hanging floral displays to beautify downtown, and yet charges nothing. It's not magic. It's the Greenhouse Project. It's real, it's growing, and it needs your help. Go online to carsоncitygreenhouse.org so together we can grow it forward.
For 50 years, Nevada Heating has been keeping people comfortable in their homes. At Nevada Heating, call the Do It Right guys and get the air conditioning back on today. That's the Nevada Heating way. Why sweat for days on end when Nevada Heating can get your air conditioning fixed today? Call us today and we'll fix it today at 323-5585 or schedule us on our website at nevadaheating.com.
Modern boutique Ahern Hotel and Event Center sits at the heart of the Las Vegas Strip. 2 floors of meeting and event space are ideal for groups and conventions. Stay in one of 200 luxurious rooms and suites. Brand your event throughout the property. Flexible event spaces make for easy planning and personalization. Take over the entire hotel with a full buyout option.
Nevada Newsmakers Goes to Washington is brought to you by Pro Group Management, workers' comp that works for you. NV Energy. NV Energy proudly serves Nevada, providing electricity to 2.4 million electric customers. And University Medical Center of Southern Nevada, offering the highest level of care in Nevada.
Thanks for watching Nevada Newsmakers. You can catch us online 24 hours a day at nevadanewsmakers.com, or you can download the podcast wherever you like to get your podcast. We'll see you on the next broadcast.